I was kind of expected to do. No, and everything looks good. Right there, yep, it's already scabbed over, and this is healing very well. Now your belly button is very swollen; it will calm down. So it is. It's just it's kind of pulled on itself, and it folds on itself like this, and so it's going to be puffy until it kind of shrinks down. Your scar is healing really, really well here. Do a little pinch later on if this doesn't calm down after about 6 months. Is what I do. I just kind of extend it up just a little bit higher. And stick a little bit out. So
there's a little stitch hanging out too.
Oh, we can cut that off. So I just can pull it. Yeah, usually by 1 month it's already dissolved. It's just out of part right there. So yeah, this is starting to calm down. That looks pretty good. Like I said, what we might do later on, I might have to maybe just do a little bit of a pinch right there and just a little under a local. We can fix that. Everything's kind of evening out very nicely. Let's take a look at this little spot we have here. So that's okay. Yeah, that's going to be just a little bit. Yeah, that's the skin is separated a little bit, but everything else underneath is healing great. So, any questions you have for me?
If I feel comfortable, can I lay down flat in the bed now?
Yes, absolutely. Yes. No, everything looks like it's doing great. So, all right.
I feel like I have another question. Like scar tape and stuff I was hearing about.
Okay.
Can I do those or not until it's resolved?
So the scar. All the scar therapies, you can put them on any of the incisions that have healed fully. So where there's a little tiny open spot on the little inverted T area, you can't put it there. Excuse me, and also right there, that little spot on your breast. But everywhere else you can use. We have one here. We have the silage, which is actually a liquid that you can put on there. It's kind of a gel that you just kind of rub onto all the incisions. Here, you can put your gown back on too.
Oh yeah.
The other things that are available are there are the silicone strips. You can get those on Amazon, or you can go to our website. It also has kind of links that are underneath there.
Oh, okay.
So now the thickness that you have there is only about this thick, and it is going to be swollen. The body is having to regenerate the blood supply back through the muscles there. You got to remember that what's down there, right down here, used to be all the way up here, and it got pulled very tightly. So it's only blood supply is all coming from this direction on down. It doesn't have it going straight through the muscles or going down into the groin anymore. It has to regrow those, so that kind of firmness and swelling that you feel there is going to be there for a while. Some of it also that you feel when you feel those little bumps all around there, those are the actual sutures that are slowly dissolving, and so that it captures some of the fat when we do this. So sometimes some of that fat won't fully survive, and it'll form a little scar ball. If it's a tender one that bothers you when you wear clothes, I can later on go and just cut that scar out of there and just under a local, and that is very quick to do that. That is actually, and it doesn't matter at this point because everything is already healed, so all the strength is back through the rest of the tissues.
Okay. Working out or anything
you're about 2 weeks away from that. Yeah, you're right. 4 weeks. You can go ahead and do light aerobics and walking around. You can use your arms. The breasts themselves is very difficult at this point to actually cause any harm to them. The blood vessels have all healed. They're not gonna break open anymore. The sutures, the way everything is settling, it's gonna be very hard to hurt that. The tummy is the one that's more of the concern, is that that this muscle repair we did isn't that strong. It still needs an extra couple of weeks before it will be to the point where it's gonna be hard to actually damage it. The suture in there is long acting. It will take 6 months to dissolve. But it no longer is providing any strength or closure to it after about 6 weeks.
Okay.
So it's now your body's doing that. So.
Okay.
All right.
2 more weeks, but I can walk around my neighborhood.
Absolutely, absolutely, yes.
Okay. But I don't think I'll take my dog. Not my dog. Still, I have a 65-pound dog.
Yeah, that's gonna probably be.
Leave him home.
Yeah, he's a squirrel. And it was out there, so yeah.
Okay. Okay, I think that's it then.
Okay.